My name is Dr. Mark Connelly, and today we're talking about dental insurance. And specifically, we're going to dive a little bit deeper into Delta Dental and why many dentists are not participating in Delta Dental any longer. For patients not really familiar with dental insurance, a lot of people will think that it's the same as medical insurance, that there's an unlimited benefit to each year. With dental insurance, the dental insurance cap how much they will pay per year. For example, $1,500 is a common maximum that they'll pay. What's most frustrating about that is that started in probably in the 60s or 70s at $1,000 or $1,500, and it has not increased since then. I think back then the price of a Ford Mustang was probably $8,000 or $9,000, and now what are they? 50, 75,000, I don't know, but everything else has gone up in price except the coverage of dental insurance in most cases. I think one of the most common frustration that we hear from patients is, one, their dental insurance doesn't cover as much as what they thought they would. They've gone for years without dental insurance and not going to the dentist, and then when they do go, they have such extreme needs. Their dental insurance coverage barely makes a dent in it. So that is very frustrating. They also get frustrated at services that are not covered by their dental insurance. They think they have insurance that it will cover everything to an unlimited amount, and that just isn't true. Another thing that ends up happening is people don't think that they could go to the dentist without dental insurance. In my opinion, do dental insurances actually help patients get the dental work that they need to have done, or do they get in the way? My opinion is that dental insurance is a benefit that you work for, and that is very nice to have. I can identify with patients who have their children, or they're watching their budget, or they're making out a budget, and it would get tight to go to a dental office and just fork out the money for dental expenditures as compared to having a dental insurance plan that would cover part, if not in some cases, all of their preventive needs. We've seen a growing number of dentists over the years going non-par with Delta Dental. I don't really understand that. I think it is one of the easier insurance companies to work with, I should say, and that it allows many, many people to get dental work done that they would not otherwise be able to do. I think to have to pay the dentist up front and then wait for the insurance company to pay you may create a big barrier to for people getting dental care, and that in this tough economic condition, or this chaotic economic condition that we're in, I think it's much easier when you have the dental insurance paying to the dentist and the patient paying their portion of that coverage. I think some dentists will stop participating in Delta because Delta controls how much that they will pay for a given service. And usually we will find that it's about maybe 20% less than what our fees are. But in my opinion, it is made up by the increased number of people that we can see and help. Despite all the drawbacks that dental insurances may have, for example, like controlling fees, or not covering certain procedures, or having different restrictions, we at St. John's Dental Care continue to accept it because I think and I believe that it really does help people get their dental care by reducing the financial barrier that people may encounter, and the research will back that up. At our office, the main thing that you should know about using Delta Dental or any other insurance program in our office is that we try our best to find out information for you and give you accurate estimates of what it's going to cost. But even when we do get things predetermined by the insurance company, they say, and right on the bottom of the predetermination, that this does not guarantee payment. So sometimes patients will owe more money than what the dental insurance said they were going to pay. And we find that's very frustrating to patients. Yeah, one of the things often that people don't realize is how complex their treatment needs might be. And by complex, I mean requiring quite a bit of dental work at a larger expense than what their insurance will cover. We've looked at that, and we have some fantastic finance sources that will give patients or help work with patients for a monthly payment that they can afford. And these companies have proven to help quite a few people in my office, and we are willing to help people explore those options. I think one of the most valuable steps that people can take to get the most out of their dental insurance is to use it. We find too many people, and in fact, the insurance companies know within 0.1% or very small discrepancies the number of people that will use their dental insurance when they quote it to a group plan. One of the things I find is that people will have it, they don't go to the dentist, maybe they're afraid, maybe they don't want to make the time, maybe they don't see the need. But when you waste your insurance, you use it or lose it. And even keeping up on your preventive appointments like the cleanings, the x-rays, the exams, so important to do. And usually there's very little, if any, out-of-pocket cost from some of these dental companies. I think the dental insurance industry is heading in a bad direction. What's end up happening is that when employers are providing benefits for their workers, what they come into is that the cost of medical insurance has skyrocketed. So in an effort to save money, they will buy a less expensive dental insurance plan, which really limits the benefits that patients can get. The changes that I would like to see in dental insurance is that, one, they pay for more things at a higher fee level with less hoops to jump through. You know, many people would wonder, why is dentistry separate from medical insurance? And it's the way the two professions developed. For some reason, the dental was always separate from medical in the training, medical schools versus dental schools. I think both professions want to keep it separate like that. There's the medicine and then there's dentistry. And so when the insurance benefits started, that was a boon to people getting medical care. And then dental insurance was actually started by a group of dentists that formed Delta Dental. I forget which year it was, but they saw it as a way of providing more people with dental care. But the main thing is the two professions have never met each other. At St. John's Dental Care, we have never instituted some kind of internal plan for patients to do. I've never seen us in the financial realm of providing either a benefit package for patients where they can pay a monthly fee or a yearly fee, or the same thing goes with our payment plans, because I find that chasing money only makes the patients mad, us unhappy. So we try to stay out of the financial arena. But one of the ways that we do help people is that we have some very good outside financing sources that work with you to get a monthly payment or financing arrangements that will work well with you to meet your dental needs. So there's two ways that you can find out more about your dental insurance. Actually, there's more than two ways. One way is that you can go to the Delta Dental website and look up your plan. They'll tell you exactly what's covered. Another high-tech way is you can take the PDF of your dental insurance coverage, drop it into ChatGPT, and they'll tell you exactly what your coverage is. The third way is, as new patients here, we will discuss and we will look up for you what your dental insurance will cover, and allows us to give you a better estimate of your out-of-pocket cost. I think so. I assume that there's very minimal out-of-pocket for the preventive, for the cleanings, for the x-rays, and for the exams. But each policy is different, but in general, I think preventive is a little out-of-pocket cost, more coverage. In short, my name is Dr. Mark Connelly. My associate dentist, Dr. Aubrey Capon, here at St. John's Dental Care, and we're here to help you. We're here to help you both clinically in the way that the procedures that we perform, and then also in being able to make dentistry affordable for you.